medical crisis. Scarcity of NHS workers as Boris turned back on call for self-isolating cut. The Omicron variant has been tearing its way through NHS staff, but the Prime Minister has ignored new calls to cancel self-isolation for health workers. Despite self-isolation being reduced to 7 days from 10 last week, absences are still rising dramatically within the NHS as more staff test positive. Around 38% of NHS employees were absent in the week up to December 23. The total number of health workers self-isolating in England has risen from 12,240 to 18,820 in a week. Chris Hopson, Chief Executive of NHS Providers, suggested the worst scenario for the NHS might not be too many patients but being short-staffed. He said, "Many chief executives are saying that, on current evidence, they think Omicron-related staff absences may be a greater challenge than the number of Omicron-related severely ill patients they have to treat." Hence, scientists, health professionals, and several Tory MPs have advocated for a cut of the self-isolation policy from 7 to 5 days, just like in the US. Earlier this week, the U.S. Centers for Disease Control and Prevention (CDC) cut down the self-isolation period from 10 to 5 days for all asymptomatic Americans who test positive for COVID. Paul Hunter, professor of medicine at the University of East Anglia, suggested that shortly, COVID-19 will have to be considered as just another cause of the common cold. He said, "We're going to have to let people who are positive go about their normal lives as they would do with any other cold. I think the whole issue of how long are we going to be able to allow people to self-isolate if they're positive is going to have to be discussed fairly soon because I think this is a disease that's not going away." Other scientists such as Professor Tim Spector, head of King's College London's Zoe COVID Symptoms Study, suggested that a cut to 5 days would help protect the economy. However, the British government is reportedly waiting for more information regarding the recent reduction in the UK. Chloe Smith, the Minister of State for Disabled People, said, "I appreciate that, for example, America is looking at this at the moment. We've only recently cut the self-isolation period from 10 until 7. We don't have current plans to change from 7 days. For weeks now, doommongers have been warning us that the NHS is facing a looming winter crisis, with the added burden of an Omicron surge threatening its ability to care adequately for patients. The crude figures add to the sense of national panic, with COVID admissions rising steadily. Yesterday there were over 1,300 admissions in England on Tuesday, the highest daily figure since February. So far the Prime Minister has commendably resisted calls to impose fresh restrictions, but if hospital cases continue upwards, the pressure will mount in the new year. That's why it is so vital to look a little closer at the data to determine the true picture of what is going on in our hospitals. Even setting aside the fact the NHS always faces a seasonal surge at this time of the year, you might be surprised by the facts. For example, figures released only on a weekly basis show that about a third of supposed COVID patients arrived in hospital for other health reasons, and tested positive only once they were on the wards. Dig a little deeper and the figures say more. Of those in a hospital bed, and who had COVID, on one day last week, December 21, 4 out of 5 of those admitted over the previous week were there for reasons other than the virus. Given its relatively mild symptoms, but highly infectious nature, I expect this proportion will increase further, with more and more patients arriving for treatment for heart attacks, strokes and serious injuries, without realizing they are also carrying COVID. That doesn't mean they do not present complications. As health chiefs rightly point out, regardless of whether a person arrives in hospital because of COVID, or simply with it, they must still be treated away from general wards to reduce the spread of infections, placing additional pressure on resources. Which brings us to the real crisis facing the NHS, an emergency that is both largely unnecessary and easy to fix. Many thousands of NHS staff are currently off work after testing positive for COVID,